Anna Grace Yarber is not the world's first miracle baby, but she is most certainly the latest to take our breath away. Her birth 2 days ago marked a milestone in medicine, an impossibility made possible. Like Louise Brown, the world's first test tube baby, born almost 27 years ago, Anna Yarber made history simply because she came into this world like no other baby before. We begin tonight with CNN's Elizabeth Cohen.
Anna Grace Yarber, you have no idea what your mother did to get you, or what your Aunt Melanie did, or Dr. Sherman Silber. You're a medical first, and your story began on the internet. Your mother, Stephanie, and her twin sister went to an infertility website after in vitro fertilization didn't work twice. Stephanie had always wanted to be a mom.
When I was younger, I used to put pillows, under my shirt and have it poked out like I was pregnant.
But for some unknown reason, she went through menopause extremely early, at age 14. Dr. Silber runs the website Stephanie visited, and he remembers getting the phone call from the sisters.
They called us up and asked, do you think, could you transplant an ovary? Despite this very, very, very cute rural accent that makes you think that maybe they're naive, they're not naive at all. They had researched it extremely heavily, and they impressed me with their knowledge.
The sisters knew ovarian transplants had worked in animals, and they volunteered to be the first human subjects. Melanie's ovaries were fine. She has 3 children. So Dr. Silber took healthy ovarian tissue from her and implanted it onto Stephanie's ovaries. It was all done as an outpatient procedure. And just 6 months later, Stephanie was pregnant. She and her husband Kevin conceived the old-fashioned way. No fertility drugs, no IVF. Her obstetrician called to give her the good news while she was at work at a bank in Muscle Shoals, Alabama.
She started screaming on the phone. She was so excited. And everybody in the bank started screaming. And before you knew it, the whole town of Muscle Shoals, Alabama was screaming.
Months later in the delivery room, the reaction was pretty much the same. Her sister was right there with her.
She cried, and she cried, and I cried. Yeah, it was emotional for everybody in that room with us.
But would this have been a happy ending if the 2 sisters weren't identical twins? Dr. Silber thinks so. He says ovarian transplants should work for non-twins, but the mother would have to take drugs to suppress her immune system.
We know that women that have had a kidney transplant successfully and are on immunosuppression get pregnant and deliver babies, so we know that can work.
So a happy ending for mother, for aunt, for the doctor who some said was a dreamer.
We're really thrilled to be vindicated.
And for baby Anna Grace, named Anna for her grandmother, and Grace.
By the grace of God that she's here.
Now, donating that ovary was not risk-free for Melanie. Because she did that donation, she will likely go through menopause at an early age. Aaron?
Why had it never been tried before?
Well, it had been tried on animals, and so they spent several decades testing it out, making sure that it worked, and testing out the principle, as it were. This was just the first doctor who decided to try it out on humans, and really because this pair of sisters approached him first.
Elizabeth, thank you. It's a great story, and it's a great story well told. Thank you. Thank you.